First, I'm gonna review the doctor's order for dressing change. I'm gonna do hand hygiene and verify the client's identity. Hi, may I know your name and date of birth? Can I check your response? And this is the same on my record. I'm your nurse, I'm Irene, and I'm gonna do dressing change procedure. And do you feel any discomfort or pain in a scale of 1 to 10? 1 is the lowest, 10 is the highest. So the client verbalizes no pain and there's no need for any pain medication. Do you have allergies or allergies in the solution that we will use or supplies in dressing change? Okay, so the client verbalizes no allergies and a solution that we will use or supplies. So I will prepare my workspace and it should be clean and the supplies must be within easy to reach. And then I will position the height of the bed that is appropriate for body mechanics. And then I will reposition the client. So this is the client's head, this is the foot, and then I'm gonna do hand hygiene and provide privacy. Now, I will prepare the sterile tray aseptically. So I will open it away from me. Metal transport forceps. So I'm gonna reposition the tray. Manipulate the supplies. So I should maintain 1 inch border. So this is the the metal forceps. And this is the 2x2 gauzes. And this is the 2x2 gauze. This is the 4x4 gauze. This is a 2x2 gauze. And then I will pour the solution. And I will add gauze. And I should create a sterile triangle, which is my patient, and then the garbage and the tray. So add another gauze. And of course my Q-tips. And then of course I will maintain 1 inch border and maintain the triangle, sterile triangle, my client, the garbage and the tray. Now I will put on the gloves. And then I will remove the dressing. So the dressing, I will observe first the dressing, I will assess before I will discard it. It has a small amount of serosanguinous fluid, and then discard. And then I will assess the wound itself. The location is on the abdomen, right upper quadrant. And I will assess for the length. I'm gonna get the Q-tips. And measure the length of the wound. Okay. And okay, discard. So 14 centimeter, and it is well approximated, close with the staples, and there's a small amount of or a mild erythema noted. Do you feel any pain? Okay, so there is no pain and edema noted upon palpation. So I'm gonna remove my gloves, discard, and do hand hygiene. And I will gonna put on new gloves. And then I will clean the wound aseptically, of course, from least to most contaminated, head to toe, midline to peripheral, and I will do dumpling first and dip it in the solution. Of course, from head to toe, away from me first, and over, 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 over. Discard. Again. Dumpling. And then dip it in the solution. And then over, 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 over. And then discard. Another dumpling. Put it or dip in solution and the midline head to toe over on the wound itself. Okay. And then I'm gonna do pat dry. Same thing I'm gonna do. Just it's like it's dry now. So, of course, starting with head to toe, and of course, away from me first. And here. Head to toe, over, over, pat, pat. Okay. And on the so I will put on a sterile gauze. And I will secure it with a tape. And of course, I will put a label. My initial and date and time of the dressing. IP November 16, 2025 and 9 p.m. And then remove my gloves. So I will assess the patient pain tolerance, and then I will position the client again on the side, reposition comfortably, and then I will position the bed the lowest and secure the call bell and proceed to documentation.